Hi, I'm Dr. Evan Adams, Aboriginal Health Physician Advisor for BC. The video you are about to watch will not only tell you something of the history of First Nations health in BC and how First Nations view health, but will tell you about an exciting and groundbreaking First Nations health initiative, a first for Canada, happening right here in BC, the tripartite First Nations Health Plan.
This first song is a tsekek. This is a chant that we use to call our ancestors to us when we're going to do ceremonies and rituals or anything of importance. These chants call our ancestors to be present with us and keep us dignified, honest, and focused on what we're doing.
Today, healthcare gaps exist between First Nations people and other British Columbians that must be closed. As First Nations people, we have always had the knowledge to look after ourselves. Our families and nations use language and stories to pass on health knowledge.
There's no IELTS. Yes, there's a Wayne still. You're the seat in Swain's Miss Timo. I this legal. Schon a Wayne sin chases. And the had the Swiss Miss Timo's Hoyim. Nithin lose the sea. Had this Hoyim had in your could do with thee. Had in Jetta, oh, our Hoyimas. That was how learned from very young, by stories, by lessons and like that. The stories were, we always said when the kids, we heard that before, and the old person would say, if you're smart, you're going to be listening the next time, and there'll be some more words added when you are growing a little bit. We can't give it to you all at once, but if you're smart, you're going to be capturing this. Fill up the hundreds of pockets in your body, in your brain, with all the things that you learn.
In my childhood, I actually was born early enough that I saw some of the old medicine that existed, where people who I thought were old weren't really that old, it's just that I was little, actually had medicines they used to work with people who were ill. And they actually had procedures for trying to deal with the emotional state of others.
Cleansing a person is very important because the person's got to know what he's going to be doing. Like the story of the little flea, the Creator came and the little flea was just crying away and he said, my feet are bleeding and the bones are showing, but it was his little knees. And the Creator says, those are your little knees you're walking on. The things you're dragging are your legs. You'll be tall if you can use them. So he told them to go and get that medicine, it was plantain, and that's part of the coagulant to stop bleeding, do healing. And he said, well, you could walk and you call that your legs. Why don't you get it for me? Go and get it. I have to crawl. And the Creator said, it would be for me, my son. It isn't for me, it's for you. So it means then that the person you're helping has to work just as much as you do.
Social responsibility is what our systems are based on. When we look at our potlatch system in our homes, we look at how we're going to give names, how we're going to do marriages or recognize somebody's death. We do a stamp of approval. But in order to do that, we need to acknowledge those people that are witnessing and such. We need to make sure that they're okay first, that they're taken care of. In our own systems too, in our governing systems, it's important that we take care of our people.
So we had a gentleman, an elder who was in our community who was blind. So,
part of our work as neighborhood kids. I mean, you can't really call a small community like ours as neighbors, but you know, we were neighbors and family and relatives, and so on. Our responsibility was to make sure that he had water. We'd go down to the lake or to the river and get water. We'd cut wood and split it for him so that, you know, he didn't have to do any of that stuff.
So if you go back in time before contact, we didn't have save-on foods. We didn't have, you know, all kinds of fast food outlets. If you wanted to eat, then you had to contribute to the gathering and preparation of food. Winters were harsh, so you had to work 9 months of the year to make sure that you had enough food put away to get your entire family, your entire community, your entire nation through that winter. No such thing as being lazy. You had to help, you had to contribute.
This philosophy of wellness has worked well for thousands of years. It was not a healthcare system, but a way of life, and uses our own health knowledge to maintain the balance of life and our good health when it is allowed to exist.